video, I'll be going over the BAPS board, biomechanical ankle proprioceptive system. So in general, this is the base plate on which the athlete or the patient will stand. We can look at the different sizes and variations of height in the half spheres that we have here. So this would be L1 to L2, L3, L4, and L5. So depending on where your patient or your athlete is in their range of motion, so this would create the least range of motion. This one would be the opposite. It's the biggest size here, so that would be creating the greatest range of motion. Once we progress from there, we can add weight onto the BAPS board itself. So if you look here, we can see that each of these are bolts, and then you can screw in this right here into this hole and then add weight onto it. So this would be the anterior lateral, this would be posterior lateral, this would be posterior medial, and anterior medial. So with positioning on this board, we would want to have the athlete stand on it, and we would sight the medial and lateral malleolus. We would also want to take note on which side this is. So for this side, this is the left foot, and this is for the right foot. So once we figure out the general premise of the board, we can start to add the athlete into whichever side they need, and then we can take the L1 ball, which is what you would want to start on. We would screw that into the bottom of the board here, and then you would have the athlete stand on it. Make sure to sight the lateral and medial malleolus, and then you could do a couple different exercises with this. So in summary, the BAPS board is used for ankle injuries mostly. It is used to increase flexibility at first, and then once full range of motion is achieved, weight can be added. It can also be used for balance, and with this board it produces controlled, calibrated, predictable stress on the lower limbs. So depending on what your goal is for that exercise, you can do a couple different things during each session. So to begin, maybe just doing a single planar motion, so maybe plantar flexion and dorsiflexion at first, trying just to tap the top side of the board and the bottom side of the board to the ground without trying to roll it or anything like that. Next would be external and internal rotation. Again, just trying to tap the sides of the boards. And then from there, you could also progress to rolling, making sure that each part of the board smoothly comes in contact with the ground. And then again, you can add weights to each of these. So if you're working on plantar flexion, you can add weight to the posterior side of this to add increased stress and to strengthen the athlete in this direction. When going through this with an athlete, we're going to want to take in the rehab process and the healing process of their ankle injury. So when we look at this, we usually want to do 10 to 12 reps. So doing anterior to posterior, lateral to medial, or doing counterclockwise and clockwise motions. We want to take into consideration what level they are at and whether or not they think or feel comfortable with doing that exercise that many times. A few strengths that I would mention with this would be it's specific to left foot and the right foot. So each of these angles and the whole shape of the board is based on the right foot and the left foot. Also, with the different variations and the half spheres, that could increase the range of motion or increase the resistance if you need to. So again, adding the weights to it. And also you could progress the athlete from a sitting posture to a standing posture. So partial weight bearing to full weight bearing. You could do balance on this board as well. When looking to purchase one of these BAPS boards, you have to take into consideration your budget and what you are looking for. So with the BAPS board, you would buy this and the 5-volt half spheres to begin. So a couple of differences in price ranges would include the cost of the rack that this comes with, and then also the amount of weights that you want to come with it. So this device could range anywhere from $545 up into the $600 price range. In this portion of the video, I'll be going over the cufflink system. So in general, the equipment that you're going to be using is this. This is the mobilizing ring. This is fitted with 5 different holes here for different hand placements and variations from a wider grip to a more narrow grip. There's also this central half sphere location right here, and that is what your axis is going to be on. This system also comes with 2 different hand placements. So this would be for more of like a push-up position, and it has these little extensions at the end. So if you flip this over, these just slide and drop into the provided holes at varying distances from the wider grip to the more narrow grip. And we would have the athlete in this position, so with hands facing forward, or we could rotate them into this position. So after this would be for a different type of exercise. So you would have 2 of these types of things, and this part is padded, so you would rest your forearm into it, and then this would be your handle. Again, these just slide into the holes that are provided. So depending on, again, what you're focusing on, going wider or more narrow, and then you just have the athlete like this, resting their forearms on the pads that are provided, and then grabbing on to the handles up here. So in summary, the cufflink system and all of its pieces that come with it are used for facilitating shoulder range of motion, also with core stability and functional stability. When looking at the progression of this, we can put the athlete in standing, so it would be something that like this. So having the handles out here, and then so from a standing position, and then we could also do a kneeling position, and then we could also do a push-up position. So depending on what handles you're having, so these ones would be more of like a push-up position. So you'd be out here, and then you would touch the top of the ring and touch the back of the ring like this, and then you would do side to side as well. You could also do a rotation, doing counterclockwise and clockwise motions, and that would be for the push-up. For these, this would be again for touching the top and the back of the ring like this, and then going side to side. And then again with the rotation, it would look like that. After we get the athlete comfortable with the standing position, we can progress them into the kneeling position. So with the push-up handles again, putting them in place on the outermost ring, or the outermost hand placements, and then they would kneel like this, and then making sure that their shoulders are over top of their hands, and then you'd be doing this right here, so touching the top of the ring and the back of the ring, and then coming back to neutral and doing side to side, just tapping and touching the bottom of the ring to the floor, and then doing rotation like that. So that's for the push-up position, and then we could also do it for these handles. So again, putting them on the outside, and then once they get more comfortable with each of these, they can progress into the next hole provided more towards the center, so getting a more narrow grip. So for this, be more down here, and you would again be touching the front and the back of the ring to the floor, and then side to side. Like that. And then you could do the rotation, making sure to go both ways. that is feeling too easy for the athletes, if you look at the ring, there's another hole that goes further in, so narrowing that base is going to require more stabilization and more focus and emphasis. So you'd be here again, making sure your shoulders are over top of your hands, and then going down, back, down and back, and then left and right, and then doing your rotation counterclockwise and doing it clockwise. All right. And then after the athlete or the patient feels comfortable with that, we can do it in a full push-up position. So out here, and then out like this, and then doing touching, and then that, just like that, and then also doing the rotation one. And then for the other handles, this is more like a plank, so focusing on core stabilization especially is the emphasis on this. So be out here, doing side to side touches, and then front to back. And that would be the exercises that you would do with the cufflink system. Then from there, if we want to go into the strengthening aspect, we use the push-up handles again. So starting on the outer holes on the cufflink itself, and then we would get into the kneeling position like we did before, and then we would go down into a push-up and then back up. So maintaining that core balance and stabilization, trying not to touch the ring on the floor. So again, it would look like that. And then you would progress to the middle holes, and then try it again. Again, kneeling. So out here, and push up, just like that. And then once the athlete feels comfortable with that, you can go into the push-up position. So legs extended all the way, and then down into the push-up and back up, just like that. And then again, if that's feeling too comfortable for the athlete and they're wanting to progress even more, just move it into the next holes that are inside, narrowing the base again. And then from there, going down into the push-up and back up. Some of the strengths, again, with the cufflink system is the differences between the hand grips that we have here. So the push-up versus the more core-focused hand placements. And then also the progression from the standing on the table to the kneeling and then to the actual push-up position itself. And so with each of those comes the 5 holes that I was talking about earlier. So from standing, we can progress them to the inner hole and then doing a more narrow grip and a more narrow base, so more stability is required, and we can do that with each of these settings. So from standing, we can progress them in. From kneeling, we can also progress them in. And from the push-up position, we can also progress them in. So for each of these steps, there is another level of difficulty to these exercises.